My name is William Hutchison, and along with my wife, I'm the owner of the two real estate companies that you see in the thumbnail. I've had a viewer ask me to do a video on the health system here. I assume that he's kind of looking for a general overview, and that's what I'm going to provide. It's not the easiest subject to research. There's not a lot of information out there. I'm going to attach two links at the bottom, one to the main hospital here and another one to the clinic that I was in with my recent health issues. They are building a big brand new hospital here that will be open late spring or early summer. I don't know how many beds it's going to have. I think the existing hospital probably has 300, and they're going to leave it open, is what I understand. First off, as a general overview, the medical center here in Armenia is centralized in a barrio called Fundadores, which is about 10 blocks from the main hospital. That's a little different than what you might be used to. Generally, doctors gravitate close to the hospital so they can scoot over there quickly. But here, it's a little bit different. In that area, there's the large clinic that I was in, probably 5 floors, 6 floors maybe, and with doctors' offices, specialists. There's urologists in there. There's cardiologists. There's doctors that do the body sculpturing. Maybe 50 beds or 60 beds, but the care is unbelievable. It's fantastic. For those of you that don't know, Colombia is consistently rated in the low 20s in the world for healthcare. Canada, my home, is rated in the low 30s, and the United States generally in the high 30s. So Colombia rated better than both of those two countries. The best, Japan is consistently number 1. The others are in the Far East and the Nordic countries. I would say in the top 15, it's pretty much taken up by the Far East and the Nordic countries. Getting back to Colombia, the doctors that do the body sculpturing have their own private clinics. They have all of the facilities in their office. And there's probably a couple of other private clinics. I'm not up to date on how many, but there's a lot of medical facilities here in Colombia. If you're coming here, my recommendation is that you look at Sura. I think they're the biggest insurance company in health insurance company in Colombia. We are covered with Sura through my wife's employment. The system is a little bit, I don't want to say antiquated, but Alba is frequently on the phone for about 45 minutes to make an appointment. It's you get a recording when you first call, and of course it's the press 1, press 3, press 5, listen to music, and you have to have Spanish for that. The system then is you get a confirmation by email with your appointment details and where you need to go. A lot of these Sura facilities are spread around town. I don't know how many they have exactly, but I've probably been to 5 different. Now, a couple are not Sura itself, but they are Sura recommended and Sura approved facilities that they send you to. For example, for x-rays, for blood work, those kinds of things. The one thing that will surprise you, if a doctor puts you on medication here, with Sura, they supply your tablets, your medicine. What they do is you have to go to a Sura office, a Sura facility. They give you a document that says a pharmacy is to supply this medicine and in this quantity, usually 30 days. And you take that to a pharmacy and the pharmacy fills it. Now, what's the cost for this? Right now, at today's exchange rate, it's $1.12. The Sura program pays for your medicine. Anytime you use Sura for a doctor's appointment to get the medicine that you need, it's 4,500 Colombian pesos, which right now at today's exchange rate is $1.12, maybe $1.15. When those run out, or just before, you go back to Sura. It usually takes maybe up to an hour to get to the front of the line, but you don't really pay for medicine here. There's a lot of over-the-counter that in Canada, I know for sure, is pharmacy issued, and you pay premium price for those types of things. Some of the medicines here, I know I have heard that some people have paid up to 9,000 pesos, which is $2.25 or 30 cents for a very expensive medicine. But that's what would be in North America prescription drugs would cost you here. One comment about pharmacies. A lot of the smaller things, you can go to the pharmacy and you say, I have this issue, and they will prescribe something for you. They turn around, open the drawer, I've got this. They do a lot of the, what you might call minor doctor work. There's been a couple of times when I had the flu, they call it gripa here. I go to a pharmacy and they give me a shot. There's a little back room and you pay very little for it. It just continues the whole process here, the whole lifestyle where drugs and things that you need for your health are not very expensive. What does the Sura health insurance cost? I have been told, basically $60 to $100 a month US per person. I don't know how accurate that is, but if that's the case, for a couple, you're looking at maybe $1,500 to $2,500 a year to have complete coverage. My recent experience with the system was unbelievable. I don't think I could have gotten better care anywhere else. The training, the facilities, the equipment that they have is top-notch. You can't beat it. Anyone coming here, and we all have to be concerned because we're getting older. Health care is a big deal. It's a concern, and it's something that has to be thought through. But I can guarantee that if you come to Colombia, there are no issues. Get Sura or one of the other companies. Alba will help. Alba will get you the signed up for the program, and then anything with appointments, blood work, anything. She can take you through the process. That's it for today. William Hutchison signing off. If you have any questions or comments, please leave them. As I say, I'm going to leave the two links to, first of all, San Juan de Dios, which is the big hospital here, and then Clínica Central is where I was when I had my recent issues. I live in paradise, guys, and you can too.